I thought I would talk about how infants can have to be protected at times of disaster. Unfortunately, time and again, we face disasters. Floods, landslides are happening many times during a year. At a time of disaster, children are the most affected and the most susceptible to different situations. I would especially like to draw your attention to the newborns and infants. How you should take care of newborns and infants at a time of disaster. They are the most vulnerable in the whole population at a time of a disaster. We know newborns and the infants are fed with breast milk. At the time of the disaster, the mother is also affected, and sometimes the mother would be under a lot of stress in this disaster, where they would have lost everything they owned and would be displaced and would be living in temporary shelters. But the most important thing we should remember is to protect the infants and the newborns. We have to provide them the best nutrition even at the time of a disaster, which is breastfeeding. We have to take every measure to protect breastfeeding at times of disaster, because it is only doing that we can save lives of newborns and infants. We have done that over the years during the tsunami and many other disasters. That is how Sri Lanka did not have a single death of children due to diarrhea, because we protected breastfeeding. We know our people are very generous. They want to give things to displaced people at times of disaster. And especially for children, if you want to look after children and mothers at a time of disaster, please support the mothers. Feed them, give them protective clothing, give clothes to the newborns so that they can be kept warm. You can give diapers. These are the things you can donate at the time of a disaster to the mothers and babies, so that breastfeeding will be protected. That is the only thing that can protect the life of newborns and infants at times of disaster.